One statistic that always sticks with me is if you read one book to your baby every day from birth, by the time they're starting school, they'll have been exposed to 1 million words. This is a lifelong journey. We've such a focus rightly on literacy, language, communication for child well-being. And that's so important that we get families starting this journey in the neonatal unit or on the postnatal ward, but also when they go home.
Hello and welcome to HSE Talking Health and Wellbeing. My name is Noreen Turley and thank you for joining us today. I'm delighted to welcome Deirdre Bradley. Deirdre trained as a speech and language therapist and is now a National Innovation Fellow with the HSE Spark Innovation programme. In this episode, we're talking about a really simple idea that's having a huge impact on some of our smallest patients, babies in the neonatal units. This new project is called Baby Talk, and Deirdre is going to explain everything about Baby Talk to us. So you're very welcome, Deirdre.
Thank you, Noreen. Thank you for having me.
Deirdre, let's just start off at the very beginning. I know you were instrumental with your team in Our Lady of Lourdes Hospital in Drogheda, and you got funding through Spark and you started off this project. So tell us a little bit about what it's about, because people who are listening may not even realise what a neonatal unit is.
Thanks, Noreen. So Baby Talk found its feet, so to speak, back in 2023. As you mentioned, my background is a neonatal speech and language therapist. So what that is working with babies who are born a little bit too early or who are born sick and vulnerable and who may need to spend a little bit longer in hospital learning how to feed in terms of speech and language therapy, but also getting medical stability and getting them ready to enter out into the world and get home with their families. So I worked for nearly 20 years in that field. So observing lots of little people, working, as I said, primarily on teaching them to feed. But I often thought as a speech and language therapist, what about their long-term language skills? What does the future look like for these little people when they go home, when they're learning first words, learning to talk? And parents would often say, is this something I should be worried about? So I really was interested in what could we do for these smallest, as you say, patients and service users. Sometimes, 500 grams, 600 grams, they're tiny little people, but just because they can't talk, it doesn't mean we don't have a huge responsibility in developing their brains. So back in 2023, I was in America at a conference around feeding, actually, and became aware of University of Stanford research around shaping the brains of neonates to work on their long-term speech and language development. And I thought, wow, this is something we can do. Some of these babies may be in hospital for 100 days for our really, really early infants. So in those 100 days, what can we do as a team to support them and their families so that when they're at home, when they're learning their first words, we've given them their best possible starts? The research was there. The challenge was, is this something we could do in Ireland? Can we get this in our neonatal unit? And as you mentioned, I was working in Drogheda at the time. Is Drogheda somewhere that we can start this process? So that was kind of the foundation for Baby Talk.
Oh God, you're talking about tiny little babies. I know you were helping them with their feeding and stuff, but I suppose in my head, this speech would be so far down the road. So tell us how you got the project off the ground or what you found in that research, Deirdre.
So that research tells us that babies who are born a little bit earlier, as I said, they have to be that bit longer in hospital, are missing out. If we think about it, they're not at home with their families. They're not still in mum's tummy. So they're not hearing voices really. So they might be in an incubator hearing a lot of beeping, not getting that same stimulation that other babies who are born at term or get home straight away after 2 or 3 days would hear. So if you think this little person in an incubator, lots of beeping, lots of challenges medically, lots of really difficult things to go through. They're not hearing mum, dad, granny, siblings' voices.
Yeah.
Hearing those little songs that they would if they were at home with mum, dad, dog, granny. So that window is a window that we thought, we need to see what this research is telling us we can do. Instead of, the challenges they face, what is there that we can support them with? And there's a lot of research around the first 1,000 days. And, parents think, right, 1,000 days, that's well down the road, as you mentioned, in terms of speech and language. But actually, if you're spending your first 100 of 1,000 days in hospital, we have to start now. So we need to get going. So the research talks to us about how can we get parents' voices for the babies in the best possible way. So reading, speaking and singing. So for these little babies, getting mum and dad reading to the baby, singing to the baby and speaking to their baby, even in those early hours and early days when things can be a little bit rocky. We know it's a really traumatic time for parents and for babies, but it's never too early to start this process. And that's really what Baby Talk was about, seeing can we get this in place to start working on the brain development long term straight away when the baby's born, or actually even when mum is pregnant and babies in the tummy.
That's just amazing, because I could imagine, apart from the beeping, because I've never worked in the neonatal unit, but being a nurse, it's quite silent apart from that noise, people being busy doing their work, but none of that outside activity or that sound that you're talking about. How did staff respond to it? Who started speaking to the baby first, or did parents feel silly to do it, or how did it happen?
So I suppose we had this research then, and we wanted to see in Drogheda what we could do. And we have a fantastic team in Drogheda in the neonatal intensive care unit, between nurses, midwives, doctors. But actually with this project, everybody championed it. We had our clerical support team, we had healthcare assistants, our cleaning staff. Everybody jumped on board when we explained what we could do. So like everything with innovation, we started small. We piloted with one family.
Very good.
This particular child now is 3, a child who I've recently caught up with to see how he's doing. And looking and working with that family, I think the key with any innovation is design it with the people who are using the service. I feel really passionately about this. So with mum and dad and this little baby, to see, well, what can we do? So we looked at that research. We brought books in primarily. We sat with the parents. We looked, explained to them, you know what? Let's get going. Read to your baby. Let's look at his cues. So, for example, if his heart is racing when you're reading, he might need a break. But equally, if you're doing skin to skin, you're feeding baby, great opportunity to use your voice. Is he turning his head? Is he opening his eyes? So it was remarkable. And those parents were able to guide us as to what is possible, but equally what feels a little bit odd. And you mentioned there, Noreen, the environment. And, it is an artificial environment. Nobody expects to find themselves in that neonatal intensive care unit wondering, am I allowed to touch my baby? Should I lift him? What should I do? So it's that piece of giving parents that framework of absolutely read to your baby, speak to your baby. We're going to guide you. And as I said, the staff were incredible. We all saw the benefits, and knowing we could do it for one family, that's where innovation starts. You see the journey for one family, you listen, you develop, you guide, and then you go to the next family, and really that kind of snowball effect. And we were really enthused by what we could see. We did measure to see the amount of language that particular baby was hearing, but even stronger than that, the family were able to tell us, we're forming an extra bond. I'm less anxious. It's giving me something I feel I can do. It's that ownership as a parent that I might be able to bring my baby home, but I can read, I can sing, I can hold my baby, I can bond. And actually, I'm shaping his brain development long term. Like, it's a really powerful thing as a parent to get the opportunity to do that.
Because I could imagine you'd feel so helpless, if your little baby, like you say, is in an incubator, maybe you can't lift them up, you can't hold them. But if you can read to them and talk to them, it must give a sense of positivity that you are doing something for the baby. And if they understand the complexity of what they're going to achieve down the road, it's fantastic. What were the parents saying to you then? Say that first baby that you had, could they see the heart rate? How did you measure it?
Yeah, staff are brilliant. Staff are such experts in neonatal care and knowing the baby's cues. So where the staff could say to mum and dad, watch out for if your baby's heart rate settles when you're reading, you're doing something great there. If your baby has to get a painful procedure like a blood test, sing to your baby, see your baby settling. And really, the whole atmosphere changes when you're reading and speaking and singing to the babies. We know they have to go through medical procedures, but if we can balance that, there's a huge amount of pain relief in hearing. You need that soothing voice, and there's nothing more soothing for a baby than mum or dad's voice. So that was showing us we were on the right track. That family were able to tell us the benefits it brought to them. And to this day, 3 years later, that particular family talk about the benefits for their baby.
And the experience at that time when they were probably feeling so awful.
I think we've such focus now, and rightly so, on parent mental health and infant mental health in the neonatal unit. We know it's a traumatic experience. Our psychologists are working with families for years afterwards. So actually putting this in something that's so powerful and so therapeutic for families and the baby in the neonatal unit has been probably as powerful as worrying about the benefits for the brain. So it's that twofold piece of the family benefits, but also the brain benefits. And I think we're moving in healthcare towards family-centred care. Our goal is in neonatal care. Parents are the experts. Parents are taking their babies home as the experts, and we need to equip them with the opportunities to bond and lead care for their babies. As staff, we can guide, we can support, but at the end of the day, the parents going home with the baby, they are their experts in their baby's condition. And it's something I feel really passionate about, that human-centred design, this idea, it is for parents, designed by parents and for future parents.
Yeah, no, that's great. I know you said the staff were great and everything, but how did you make it feel achievable for staff? particularly with all of the other things that they need to do. I mean, I'm sure some of them were thinking, oh my God, I'm doing all of this. I'm trying to monitor everything that's going on. It's another thing. And then you have to monitor it. And it's not easy, like, to get something changed or something new to be implemented someplace, particularly like that when things are, I'm sure they're pretty tense on a daily basis.
You're absolutely right, Noreen. And I think with design and improvements, and we look at what projects that don't sustain, I think the key is it has to be transferable, but also actually the golden nugget here was that the parents are the key. So this isn't something extra the staff need to do. This is something that if we put in place for parents, that parents take the lead. And yes, they might need a little bit of staff guidance, but actually this is about the parents, designed by the parents, and parents leading it. And their goal with this was that it was embedded in the culture of healthcare, and that, from antenatal classes onwards, the parents would know about this. That parents would seek, well, where are the books from the book library that I want to read to my baby? We've designed, and I suppose this is where Spark have come in, we've had beautiful resources designed by the Spark programme. For example, we have a QR code that brings the parents directly to all the information. So actually the parents from the get-go know what they should be doing and need very little staff support, so to speak. And I think it's testament to the design that we've got with families now on the ground up.
Have you developed specific books for babies in that environment?
This is where our HSE library colleagues have been incredible. And I have to say, from the get-go, Ruth, our librarian in Drogheda, she looked to see, well, what research is there in terms of which books are specifically appropriate for our neonates and our tiny babies. So they need to be short. They need to be targeted in terms of like the length. So we know our little babies, while this can do great for their brains, we can't bombard them either with language. They tire very easily, particularly if you think a tiny baby in an incubator. So these books are short. So you'll know some of these names from your favourites, perhaps yourself, The Gruffalo, I Love You to the Moon and Back. All short books that are suitable for the age range. So Ruth worked with the Spark designers on having kind of a framework, a book list that would be suitable for these babies. Another consideration was infection control.
Yes.
It's an intensive care unit. We've got very vulnerable infants. So books need to be infection control compliant, wipeable, washable. They go through rigorous decontamination. Then another consideration was for our multilingual families. Not every book should be in English language. We want to make sure this project is for everybody. So we had to look far and wide to make sure we had books for all languages, all literacy skills, all backgrounds. So quite quickly we moved beyond books into parents recording stories. And this is where we were delighted to get Tonie Boxes on board.
Tell us what that is then.
So we have in each of our 19 units now, we have Tonie Boxes, which allows parents to record their own voice for their babies. So if, for example, a mum or a dad are unable to come into the unit, sometimes with separation, for example, if a baby has to go to Dublin for a procedure, if a mum and dad, for example, are in Donegal, they can record their voice reading a story, singing a song, which can be played to their baby then, the audio recording box. And this has been really, really powerful for the project, that it means that everybody's included. We had some beautiful examples at Christmas of grandparents reading stories for babies that they hadn't yet got to meet, who were very vulnerable, and for those babies to hear their family voices, I have to say, is really powerful. And as staff, it's been eye-opening to see actually they are the things that families will remember, that they've had those opportunities, and that's really, really precious.
Oh my God, just thinking about it, of teeny tiny babies and them hearing their grandparents' voice for the first time, or grandparents recording those and maybe feeling like they can't do anything, they can't hold the baby, they can't even see the baby, but they can deliver this message to them, and it's something that they'll have forever as well, that recording.
Absolutely. It's that human piece again, isn't it, that this project continues to evolve based on what our families and our grandparents and our communities are telling us. We have our library colleagues in the hospital work brilliantly on getting the resources on the ground, but actually the piece afterwards then, when the babies go home, we're getting our community librarians involved, because really this is a lifelong journey. We've such a focus rightly on literacy, language, communication for child well-being. And that's so important that we get families starting this journey in the neonatal unit or on the postnatal ward, but also when they go home. Read to your baby, work on their communication skills, lovely bonding. And, as a society, we're trying to move away from screens and thinking about what the benefits are for our children. And really, this is something that's beyond healthcare into education and well-being. So, a big shout out to our community librarians who are hosting events for our babies. We now have NICU graduate events for these babies when they go home. We've had some beautiful events. We had a lovely one in Bettystown Library where we had music therapists in, and seeing groups of families sitting on the floor with their babies who've been through really difficult journeys in neonatal units, and reading, enjoying music, bonding as a community as well. getting families together. Something so simple has really grown legs, so to speak.
So Deirdre, I know you're mentioning Drogheda and Bettystown, but this has started to roll out right across the country to all of the neonatal units around the country. How did you get them to sign up?
Yeah, so do you know what, Noreen? The enthusiasm on the ground never ceases to amaze me. So with the Spark funding, we had some extra resources to see, well, how do we scale this? How do we make sure that every one of the 6,000 babies in the country get the same access? And it's something I feel quite strongly about, that it shouldn't be based on where your baby is born and which hospital you're in.
Or your postcode, as they say.
Exactly. We don't have postcode lottery. So again, if we have something, let's not reinvent the wheel. Let's get those same resources packaged and to all 19 units. We've 19 neonatal intensive care units. So good old fashioned sending a letter. So got in touch with all 19 units saying, we've done baby talk. This is what it's about. But more importantly, this is what our families are telling us. Would you like to get involved? And the response has been phenomenal. So, for example, we've been up in Cavan in the neonatal intensive care unit. We've been in Sligo. Yesterday, I was in Portlaoise. They've just launched. And it's really, really important that, as babies move through the system, that they can continue to access. So, staff in Portlaoise telling me yesterday, the babies in the Coombe, parents had been reading to their babies, singing to their babies, having that encouragement. If they come back to Portlaoise, we want the library opportunity there for them as well as they're getting ready towards home. So it's really important that we offer the service nationally. We have things now like we have our YouTube channel. We have some educational videos for antenatal classes. If we can get the message out there to society and to expectant parents that actually, even if your baby doesn't end up in an intensive care unit, start reading.
Yeah.
I would say start reading to your bump. It's never too soon. Your baby can hear you. We know babies can hear in utero. So get that language. It might feel a bit strange reading to your bump, but it's never too early to start. And for siblings, grandparents, let's all get reading, get singing. Now, the singing is a bit tricky if we're not musical.
Well, yeah, I'm not sure if I'd be singing.
And quite interestingly, for the first pilot of this project, the reading and speaking to the babies statistics went up rapidly. The singing took a little bit longer. So one of our goals for the coming year is we're working with some amazing music therapists to get music on the ground in the units to make sure we're encouraging people, because music is so powerful and it's just another tool for babies to hear their parents' voices. So, I'm hoping music will be embedded in this within the 12 months. But as I said, I'm not very musical myself as a speech and language therapist, Noreen.
Sounds like you're doing pretty well. Did you get any pushback? It's not going to be for everybody for whatever reason, but did you get any pushback from it?
Absolutely. And I think it's meeting parents where they're at. So, I'm very conscious when we're observing, and observation is so key, that it's the timing of it. So for some families, day one of life, if their baby is born unexpectedly, there's one particular dad, I will never forget it, baby born very prematurely, mum very unwell. For him, he needed something that first day to do. And I remember speaking to him about it and saying, would you like to? And he said, I want to right now. And actually for him, the challenge was not fixating, on the reading and communication.
Yeah.
But equally other families, where maybe they've had a tremendous shock, their baby being born unwell. For them, it's too soon to start.
Yeah.
So it's that piece of meeting families where they're at and having it available to them when they're ready. And maybe they want to read, maybe they want to sing, maybe they want to speak to their baby, or maybe they just want to be aware of it as something for down the line. So I think with everything, it's having it available, having the access there is key, but everybody's journey is different. And something I suppose for myself, my own first child was in the neonatal intensive care unit and I was separated from her for the first couple of days because I was unwell. I'm thinking for families like that, having it for parents that maybe can't come to the unit straight away, for example, if mum is on a different ward, being able to give the information. Do they want to record a story? Do they want to pick a book to send down? Everybody's on a different journey. Some of our babies have to go sometimes from regional units to Dublin if they're really critically unwell. Again, can we send a story with them? Can we send a song? So everybody's journey looks a little bit different, but having it available to all is key. The health service is there for the users. It has to work for them in whatever way, shape or form they feel is best for their family.
Yeah. Oh, I'd like to come and see this in action.
You're very welcome to Noreen. And I think actually as well, I've come full circle on this. It's the family. We're only cheerleaders sometimes with this. The families are doing the work. The families are encouraging other families and actually having those stories. Somebody who has a tiny baby and everything might look a bit bleak, talking to them about other families' experiences and what they got from it is far more powerful than me coming in as a speech therapist saying, you should do this.
Yes.
Listen to other families. We all learn from each other. And I think in society and culturally, learning from our peers and what worked for them, it's a bit like, in feeding or your baby learning to walk, you learn from other families and tips they give you are sometimes as powerful as what the professionals will tell you.
Yeah, no, definitely. And you did mention there about not just neonatal, but for babies from when they're born. They don't have to be in the neonatal unit, the importance of reading and the importance of community libraries as well, Deirdre. From a speech and language therapist, then that's huge for kids.
I think so. And I think it's something we really need to focus on in general, like the health promotion piece, that actually speech and language development is from the get-go, as I mentioned, in utero, as soon as you go home. Unfortunately, the focus in speech and language therapy is quite often when a child is showing signs of delay. And I think that's where we need to move. We're not necessarily where we should be at in terms of the promoting reading and language development for all. I'd love to see an ideal state in society where we're providing information and support for families from the get-go, speaking to your baby, getting on the floor, things like getting face-to-face with your baby. So when you're feeding your baby, think about the language you're using. When your baby's on the floor doing tummy time, can you bring in some music? When your baby's in the pram, if they're facing towards you, are there keywords you could be focusing on? So for every baby, really, we need to be thinking about the input they're getting. And when parents see their baby responding, we call it the kind of to and fro, serve and return. So if I make a sound to my baby and then my baby responds, we know my baby's learning from me. But also as a parent, there is nothing more rewarding than getting that to and fro from your baby. You're shaping their brain, you're shaping their development. And one statistic that always sticks with me is if you read one book to your baby every day from birth, by the time they're starting school, they'll have been exposed to 1 million words.
That's a great way to look at it.
Do you know what I mean? Like, let's not wait till your baby is 2 or 3 or 4 and we're thinking about, well, where are they at with their speech and language development? Let's start now.
Yeah.
So that little person is heading off to school. You've already done so much thinking about their reading and their language exposure. So I think as a society, as a group, as a community, if you're a grandparent, an auntie, a friend, chat to the baby. Life is so busy for us all now, but I don't know about you, Noreen, but for me, I think back to bedtimes. One part of me with my own children, we're thinking, let's just get them to bed. Yeah. I have to get on with the washing. But on another level, that bedtime story, that wind down, even siblings reading to your younger siblings or chatting to them, it's absolutely powerful. And we're doing so much as families then if we can do that. So starting small, go to your library, pick up a book. Every child loves going to the library, picking out books. Even that process of borrowing the books, returning them, looking through the books. Can you give your child a book in the car to flick through, you know, a board book? Can we put some music on? I'm a big believer in audiobooks in the car, even just to chill everybody out. But again, that language piece, you know, singing your nursery rhymes with your baby. There's so much we can do, and parents are champions. I'm such a big believer in the power of a parent. If you tell a parent that they're working on their baby's brain development, there's no looking back. Yeah. It's wonderful to see, and I feel very privileged to see this unfold on the ground. It's really lovely to see.
So if we want to just keep this really practical for everyone listening, if there's a tired parent on the bus or someone at home with a newborn in their chest, what are 3 simple, realistic ways that they could start today? So no matter where their baby is or what the situation is, they know that they can have an impact on the brain development.
So the biggest thing really is you are your baby's best toy. And I always come back to this with parents. You are the key. So you face to face with your baby and the words coming out of your mouth. That is the key. So number 1, you. It's the person.
Yeah.
But nothing else. Your baby is getting your tone of voice, is getting your eye contact, is getting that idea of to and fro, that if I say something, then the baby learns to say something. Maybe it's a little coo, maybe it's a flicker of the hand. They're learning those really early conversation skills from the first hours of life. So that's the first thing. The second thing I would say is start small. So parents often say to me, I feel so overwhelmed. Where do I start with this?
Yeah, exactly.
Start small. Pick a book. Pick a song. So is it going to be Ring a Ring a Rosie? Is it going to be the Gruffalo? Pick something, and repetition, repetition, repetition. So when you think you know every word of that story or song off by heart and you're dreaming about it, perfect for your baby. So your baby learns through repetition. It's over and over and over and over. And I can see you smiling, Noreen. I'd say in your house, I know in my house there was books. I thought, if I read that book again. But that's how we know children are learning. They need to hear things up to 50 times to start to lay down that scheme of those words. So the repetition, you are your baby's best toy, and starting small. And already you're winning. If you can do that, you are doing so much for your baby's communication and brain development. And that is going to be absolutely key. And then you can build on that. And the next scaffold, then maybe those words that you're working on, as your baby develops, you may start to work on little sentences. So those kind of small key pieces. And it's having confidence really as a parent that you do know your baby. If you're watching your baby, you're noticing what they're learning from. Are they trying to make the shape of a word? Are they making little sounds in response to, oh, McDonald with the animal noises? You know, it's all those really simple, traditional There isn't a toy you need to buy, or there isn't a fancy way of doing this. I would say the traditional interacting with your baby is absolutely key. And you know what? Enjoy it. Because there's no greater experience than bonding with your baby over singing or reading a story.
Like you were saying earlier as well, go to your library and get those free books. It doesn't have to cost a lot of money, or you don't have to get anything too posh or too big or too intricate. Just keep it as simple as possible, you know.
We're all trying to get the message out there. So again, if it's something, you know, you've experienced or you've had the opportunity to avail of, tell the next parent. I would say if you're sitting in an antenatal waiting room, chat to the person beside you about speaking to their baby, reading to their baby. Let's normalise that so that it feels that it's something we can all do and it doesn't feel like a strange concept.
I'm sure it's incorporated into antenatal classes, the importance of sound and speaking to your baby.
Absolutely. So we certainly talk about, you know, reading to your bump, but I definitely think it's something we can do a little bit more of. And I think it's getting earlier and earlier. One of my speech and language therapy colleagues talks about early intervention. And then, you know, in neonatal units, we talk about ultra early intervention. The next bit will be as soon as you know you're pregnant, but it's never too soon. And as a parent, as soon as you're pregnant, get thinking about one lovely idea. I think lots of people have baby showers now and they're thinking about, you know, baby registries. Why not a baby book library? So why not ask people in your family to buy a book? Something I did myself, one of my children, put a little message in the book so that child then has a book library of books from all members of the family that have chosen a favourite book. And it's really lovely to share that book then with the child. It's something that can evolve with them. And it's actually something I found our doctors and nursing staff have said, you know, I remembered that book from my child or my grandchild. And it's a great conversational starter in the units, you know, thinking back to our own childhood, what books, what songs stand out. And, you know, they've stood the test of time for a reason. We know they're perfect for babies' brains. So get going, get started, and don't feel intimidated. The support is there. Staff will help you and champion you in this, but the parents are the key.
Brilliant. When you look back at this whole project, and apart from the energy and commitment, obviously, that you and your team have given it, has there been anything else that has really made this happen or got it off the ground?
Yeah, so I suppose from those kind of early days in 2023, great help from the University of Stanford, so good sharing their research. The key for us actually was when we approached Spark, so myself and then my neonatal colleagues and the HSE libraries and the community libraries put in an application to Spark.
What is Spark again?
Yeah, so Spark is the HSE Innovation Unit, so it really champions the front line. So frontline clinicians go in the extra mile, and what can we do to bring those projects on the front line forward? How can we sustain them? How can we scale them? And how can we diversify them? So the project was going well in Drogheda. We knew we were making an improvement for the babies on the ground in Drogheda, but we knew we could do more and we were excited to do more. So as a team, we approached Spark and we put in a community-based application. It's called Spark Fusion. And the process was, what can we do as a collaboration? So Spark really believe in collaboration. What can we do to bring this project forward? So as I mentioned, the Community Library, Health Libraries Ireland and the neonatal team with myself involved in Drogheda, we were really lucky that we got Spark funding. They believed and championed our projects. So that opened so many doors for us. We had Spark graphic designers come on board to make sure our resources were right for families, were right for different backgrounds, different languages. We also had service designers that really helped us hone in on what can we do efficiently? What can we do to make sure we are getting the message on the ground quickly, effectively, and again, fit for purpose for all our families. And then the key really was mentoring. I have to say, the people in Spark, they were phenomenal. They helped us communicate our message, thinking about what was key. And actually, at the end of the day, that human-centered design, and Spark really is about human-centered design, putting that service user at the heart of it. And it's something I think in neonatal and paediatric care we have to think about. We don't necessarily get huge investment. It's one of the most underfunded areas of healthcare. But actually what Spark did was it shone that spotlight on what can we do if we start with our youngest service users and our families. That will have a huge implication throughout the health service. Like, these little people are the healthcare users of the next 80 to 100 years. So Spark put that spotlight on our smallest people to see if we get it right for them, how can we get it right for all the babies throughout the country that will then move into, you know, paediatric and adult services. So it was an absolute game changer. Spark has been the difference in that it has the resources for us. As I said, it's got that design piece. It's really helped us kind of do that discovery with families of what's working, moving beyond, you know, a tick box questionnaire
or just handing somebody a book.
Exactly. Innovation is that blue sky thinking, not just thinking outside the box. It's thinking, well, you know what? what can we do, and always going further. And that evolution that a project has never done. Innovation projects consistently evolve. It's been really interesting to me for Spark to see that it's never done. It needs to evolve because the service evolves, healthcare evolves, and also our families' needs continue to evolve. And that investment in our tiny people and their families is actually an investment in our health and well-being and our societies. So I think more of that spotlight is key. And without Spark, that wouldn't have happened. So I'll be forever grateful that Spark gave us that spotlight and have continued to champion this project and let it reach all 6,000 babies in neonatal units that are born annually, but also, as we mentioned, babies born throughout the country. My blue sky thinking would be, if you're born in Ireland, you have an opportunity to avail of Baby Talk. That is the ultimate goal.
I know you're very grateful to Spark. I'm sure they're very grateful to you and all those little babies around the country who have benefited. There's so much heart behind this, Deirdre, and it really just shows, I think, how a simple idea encouraging parents and staff to speak, read and sing to babies can grow into something much bigger if it's supported in the right way, and how these innovations start off small and now you have them nearly all 19 neonatal units across the country for our tiniest little people, as you describe them. It's just amazing. It really is. It really reminds me that small everyday moments, a few words, a short story, a familiar song can make a meaningful difference in a small, teeny, tiny baby's life. It's just incredible to even imagine it. You know, for me sitting here, like I say, I've never worked in a neonatal unit, but the impact that it can have. Thank you so much, Deirdre, for joining us today. That was really fantastic to listen to. And I think we could get you back again in another 6 months to hear about how Baby Talk is going around the country. For our listeners, if you found this episode helpful, please do share it with colleagues, families and friends. If you'd like to get in touch with us, please email the HSE Talking Health and Wellbeing team. And you can also find out more about Healthy Ireland at your library and HSE Library Services, which provide health and wellbeing books, online resources and events for both the public and healthcare staff. You've been listening to HSE Talking Health and Wellbeing. Thank you for listening.